welcome back to Crush Medical. We have another high yield board question here. Make sure to like and subscribe to the video and to the channel. Help us grow so we can continue putting out more free content. And check us out at crushmedical.com, where we have a free MCCQE1 study guide as well as a high yield Anki deck, which is one of our best sellers. We also have premium CaRMS support services, coaching, interview preparation. Everything is available at the link. Check us out. Now let's jump right into this question, okay? A 13-year-old girl presents to your clinic requesting oral contraceptives. She is sexually active and worried about condom failure. Her partner is the 19-year-old swimming instructor at the local community center. She is otherwise well and attends the visit alone. Which of the following is the most appropriate next step in management? So I flagged this as relatively easy question because we should be able to pick up what the concern here is right away. That being said, this is a very high yield and frequently tested topic that students mess up all the time because the options can sometimes sound tricky and sound very non-specific, and that throws off students. So let's just go through this one by one, right? The first option is ask her to return with a parent who must provide consent for oral contraceptives. Right off the bat, we can say this is incorrect. And the reason why is because you do not need parental consent for oral contraceptives for women, okay? So a capable adolescent can consent to contraception. Refusing, that's even a bigger concern, right? That creates a barrier to care and misuse and misses the abuse. So that is very high yield, okay? Moving on to option B, ask her to return with her partner to discuss sexual education and barrier method techniques. This would again be incorrect. It doesn't at all take a stab at what the real concern here is, and more than that, it's reframing the real concern here as a knowledge gap, right? So we'll come back to this in a second. So as we move forward, let's just see what else we get. Okay. Option C, provide the oral contraceptive prescription. So technically, legally, that is an option. That being said, there is something that needs to be addressed before we can do anything like this. So in this case, it would be incorrect, right? So the general idea is that it's part of the good care, but this is not the priority. There's the elephant in the room, which we will get to in a second. And yeah, so let's move on to option D, right? Contact Child Protective Services, which is in fact the correct answer here. And again, this is a very high yield question, very easy, and a question you absolutely cannot miss here. This is child abuse, right? This is sexual abuse. We have a 13-year-old girl and a 19-year-old swimming instructor partner. So this is something that needs to be reported to Child Protective Services. So let's just quickly go over the answer explanation. 13-year-old, 19-year-old in a position of trust. So again, more often than not, some of these partners can be in positions of trust, whether that's a swimming instructor, a basketball coach, or a tutor, or some workplace employee. Like, these are people that these younger adolescents can sometimes look up to, and that is a concern here, right? Outside of that, the age gap and authority removes any close in age exception, right? So this automatically triggers the idea that this is a mandatory duty to report. So a few important things we have to be aware of. Confidentiality. So again, confidentiality has limits on its own because we're dealing with a minor. This is something that needs to be reported, and you break that sense of confidentiality, right? Because someone is being harmed here. Mandatory reporting. Physicians must notify child protection. Very high yield. You must report this. That is always option number 1. Okay. And option number 3, or the last bullet here, is known abandonor is extremely important. In real life, both in the clinical setting and even for board purposes, counseling, therapy, and providing support resources, whether that's through community outreach programs or women's health clinics, really, really important to provide that supportive care along with making sure we address the real concern, okay? And lastly, moving on, obtaining a pregnancy test and screen for sexually transmitted infections. That is also really important. High yield, this is the distractor, I would even say, because these are things you still would want to offer this patient, right? Anyone who's sexually active, you want to offer them STD testing. You want to offer them, if they're a female, pregnancy testing. That being said, it doesn't surpass the idea that this needs to be reported, right? That is number one priority here. We've got to report this. Make sure that the right, the protective services are involved in this case to address the relationship. But outside of that, these are still precautions and supportive services that you would still offer for these patients, okay? If you found this question helpful, make sure to like and subscribe, and we'll see you in the next video.